So here we are, and a small and mighty group. So hopefully some folks are able to listen to this recording later, but we're going to go ahead and get started with just introductions of who's here. So as we go around, if you want to share, um, any updates or good news or things that, have happened since we last met, which has been almost a year. Would love to just know what's going on in your side of the world and in the work that you're doing. So I will kick it off and just share again. I think everyone knows me, Kim Whitmore. I'm an assistant professor in the College of Nursing at Marquette and a research consultant with the Arch National Respite Network. And updates. So already shared a little bit while we were waiting for folks, but the state of the world is a little uncertain right now with a lot of funding, and there's been a lot of challenges to comply with requirements from this administration around DEI. And so we are just trying to, I think, do as best we can in the circumstances right now. And um,
Oh, I think Kim froze on us.
Yeah, she did.
Yeah.
I think the cat cut her out.
I was going to say, Kylie, your guest must have hit the pause button. Yeah, there you go.
Yeah, there we go. Okay.
There we go. Okay. Muffin messed it up, I think. But yeah, so I was just saying that, we're trying to move forward with things the best we can. In my personal world, we are working on continuing to promote our student respite toolkit that we developed, and I can share links to that, as well as the 2 white papers that came out of the Committee for Advancement of Respite Research, our Value of Respite Framework, and our recommended common data elements for respite research. And so those things are, continuing to move forward. We also received some funding to continue to expand and enhance the National Respite Care Provider Training. So I'm working with the Respite Care Association of Wisconsin and some national partners to continue to promote and refine and evaluate the impact of the National Respite Training. It's going to be translated into Chinese. That's the language that was selected for the 3rd translation. So it is currently available in English and Spanish, and working to get it translated into Chinese. And we continue to have lots of interest in people taking that training and completing it. I think we just had a meeting about that, Tyler, was like quadrupled since we did the pilot. And so, a couple thousand people have completed that training, which is awesome. We also do still have and are continuing to promote the National Respite Care Provider Training Replication Toolkit. So that is something that if others want to take that training content and move it into their own platform, whether that's in person or online or in whatever format, that is something you can request and have all the resources and materials that have been developed, again, both in English and Spanish currently. So that is all very exciting and fun things. And then kind of building off that, another training initiative that we're working on is the expansion of our e-home care training. So this is a training more specifically to the care of children with complex medical needs. We currently have 8 modules on different topics to care for that population in the home care setting. So we have one on the care of trach and vent kiddos. We have emergency preparedness, central line care, for skin activities of daily living, ADLs, infection control. So there's a series of those e-home care trainings that are out now done, available. They're free. They include free continuing education credits. So again, I'll share links for all of these in the notes. And then we did receive funding to expand that even further. So we're going to be adding 4 new courses. And pending legislation in the state of Illinois, we are going to be creating a bundled certificate program with a selection of the courses that have been developed specifically for parent caregivers, because they're in the process of passing legislation to allow family caregivers to be paid to care for kids with complex medical needs at home. And so what part of the requirement of the legislation is that there's a training for that. And so we're developing that training if that legislation passes. So lots of fun things on training the workforce and trying to continue to promote research and different innovative ways to use respite, like the Student Respite Toolkit. And the other thing that I'll share too, earlier this summer, I was invited to speak at the National Academies workshop on caregiving, which was awesome. And so there's resources and proceedings of that great national conversation that happened earlier this summer. And then I think the last update I'll share from my end is I'm also on the project team with some national partners to develop our national research agenda for broader caregiving issues. So again, we have the research agenda for respite care research, but there's now, as a direct funding from the national strategy for supporting family caregivers, we are working on developing that research agenda and other supportive resources to advance caregiving research nationally. And so I'm leading the development of that care agenda. And we have a great draft. We're still integrating some feedback from different stakeholder groups and hoping to have that released here either later this year or early spring. So lots going on despite funding uncertainties and challenges, but we're staying very busy. We currently do not have funding through ARCH because ARCH does not have funding right now to support the Break Exchange. So Tyler is here as a volunteer today. I use just the small amount of funding we get to support him. I do this through my role at Marquette, so I've never gotten paid for doing any of this, but Tyler has gotten a small amount to help support the Break Exchange, but right now he's not. So thank you, Tyler, for continuing to support us. Our hope is we'll secure some funding to help him in the near future. But yeah, it's a lot, but that's me. Tyler, do you have anything you want to add to that?
I didn't just no. Basically what Kim said.
Yeah. Great. Do you want to share? I know there's probably interest, especially from our international colleagues, on like some of the advocacy work you're doing and some of the policy things that are happening right now in the world of disability.
Yeah, so I mean, I don't know how much you are aware about what's going on here in the US, but the Medicaid funding has been severely attacked in the US, which is what provides home health care and caregiver services in the state. So home health care is under severe attack and threat, and also other disability rights, and yeah, just losing potential funding and services is a very legitimate concern for many Americans.
Yeah. And we continue to have a caregiving crisis. It's really hard to find
Yeah.
caregivers. I know that, lots of conversations I've been involved with on that professionally, but also personally. Like I have a lot of friends with disabilities who rely on caregivers. My father has caregivers for dementia, and it's just increasingly hard to find people. Really, really hard to find people. And so we really got to figure out how to not roll back support, but enhance support to increase pay and benefits and things to get a stronger workforce to support people. So yeah, it's a lot. So yeah, I see Katie joined us. Hi, Katie. It's great to see you. I know you're probably at work right now, but if you can say hi and you want to, feel free to unmute and just say hi and introduce yourself. Oh, there she is.
Sorry, just catching up on in between patients and that. But I'm Katie. I'm a research assistant at Marquette. I've worked with Tyler and Kim for I think a few years now. I took the summer off, so I'm kind of getting back in the swing of things, and I help with a lot of the newsletters and kind of the day-to-day activities with the Break Exchange.
And she had a baby. That's why she took the summer off. She has a beautiful baby.
6-month-old today.
Oh, today? Yay. Happy half birthday. That's great. Ken, you want to share introduction and any updates on your end?
Sure. Hi, Ken Genwick, Vice President of Programs for the Health Foundation for Western and Central New York, and we're a regional health foundation that operates out of the Buffalo in Syracuse, New York areas. And so our foundation really has a few areas that we focus on to improve health equity and provide support for organizations that serve really a few areas, focus areas. Uh, Young children birth to 5 and maternal health, as well as older adults and their family caregivers. And so, since the last time, I've been a part of these calls. I mean, I know really since the beginning of the year, our really a big focus of our foundation has really been trying to understand the impact that, that the funding uncertainty is, from the federal government, and really trying to work and understand from the organizations that we serve, what their needs are and have been due to some of the funding cuts and that. And so it's really been a big focus area of ours over, well, since the beginning of the year. But we also are continuing our grant making and our funding support through our various strategies that we do have. I can tell you really more specific to our respite programming that we do have. I think you're aware of our Exhale program that we have. Those programs are still going. Our pilot projects, they're actually coming to an end soon, by the end of the year. But what we're seeing is there's a number of organizations that we've given some like no cost extensions to for them to continue the work. And we're actually looking at that right now and identifying some of these pilot projects that we believe may benefit from additional funding. So we're looking at all the pilot projects to say which ones would we like to discuss and work with about seeing if there could be some continuation grants. So we're sort of in that process right now. We launched last year, and I don't know if I shared this with the group, but we saw so much success with the Memory Cafe model that we launched a collective of memory cafes with arts and cultural organizations in the Buffalo and Western New York area, and we have over a dozen memory cafes now that have launched. And we've been watching those grow and trying to understand the which ones have been most successful in watching that. And I think that's one area that we're looking at, some potential continuation for that as well. And those are really our respite programs, but we're engaged in a lot of other grant making to try to identify evidence-based and evidence-informed programs to try to provide greater support for older adults and caregivers in our area. And we're actually partnering with a few other foundations to launch an RFP in the next few weeks that to bring evidence-based and evidence-informed programs to benefit older adults and caregivers into the Western New York area. We're partnering with the Hartford Foundation and our RRF Foundation as well, with an RFP that's going to be launching later this month. What we're hoping is that we're going to be able to have some organizations identify a couple evidence-based programs to bring into our regions. But what we're finding is those evidence-based programs, many of them center around respite and caregiver support. So, we're hoping is that through that program, that'll help us bring more evidence based programs into our regions that we can also look to help spread through that. But that's really our work more specific to caregiver support and respite that we've done. Oh, one other thing I did want to mention as well is we just kind of relaunched or honed in our strategies in a lot of our strategic plan, in those centering around caregivers. We're really looking at a few a few areas in the community to focus on, and the faith community is one that we're really focusing on right now. And we just had a recent convening with a group of faith leaders and places of worship in a few of our larger counties in the Western New York area, and we're really working with them to help identify areas of interest. And not surprisingly, respite is one of those. So we're going to start to work with the faith community, but really taking our time to develop those relationships, understand what they might be interested in as far as respite goes, and hope that can lead to some partnerships and growth of respite with the faith community in the area.
That's great, Ken. I just want to remind you, if you don't already have this on your radar, that Arch does have a great volunteer and faith-based respite toolkit on their website that could be definitely shared with those partners or used for some guidance on best practices for volunteer and faith-based respite programs.
I don't think I was aware of that, so I will
Oh,
take a look at that. Yeah.
I can send that
Could you
to
share, or I could always
Yeah.
just go online and find that? Yeah.
Yeah, I can share a link to that in the notes.
Perfect. No, that'd be great. Thank you. That will definitely help. Us
Yeah,
have that
I'll
discussion.
make a
Thanks.
note of that. Awesome.
Sure.
Great. All right. Thanks so much for all the updates and thanks for all you're doing. Great things coming out of the Exhale programs. And are you planning to do like any sort of summit or webinar to showcase kind of the results of those pilots at any point?
That's a good question, and we actually have a kind of funders and leadership meeting coming up with TPI, who leads that work, and I will find out what their plans are.
Yeah,
to see what
because
sort of
that's
catch them up.
something
But yeah.
too, if you guys could do independently, or we could partner too and do that as a break exchange webinar as well.
Okay. Yeah.
Yeah.
That's a good suggestion. Thank you.
Yeah.
I will get back to you on that, Kim.
Yeah. Great. And Tyler can keep you on the list of people he harasses for webinars too. So
Absolutely.
Awesome. Great. Diane, how's everything for you?
Okay, yeah, so I'm Diane Seddon. I'm based in the School of Health Sciences at Bangor University in the UK, where I'm Director of Research. In terms of ongoing work, I'm currently completing a national evaluation of our National Short Break Scheme. So that was a 3-year project, which comes to an end in December this year, and has been a really interesting piece of work and shown some really positive outcomes from that new scheme, both for carers, for people they support, and also for the organisations and staff involved in planning and delivering breaks. So initially, the Welsh Government set aside £9 million to fund carer breaks over a 3-year period. And it's been a real success story. We've fed in our evaluation findings to their programmes of work, and they've recently announced a further £3.5 million for carers. So that's £12.5 million in total over a 4-year period. So really pleased to be involved in that work and lead on that evaluation. And Tyler, if you want to, you can add me to your people you harass for webinars. So once we have reported to the Welsh Government, I'd be happy to share some of those findings at a break exchange webinar, if that would be of interest to people.
Absolutely, yeah.
Yeah, we've also had some funding success. So we've just secured funding for a new 3-year study looking at how carers' needs are assessed. And whilst that isn't short break specific, the carers' needs for respite and other types of help and support will be addressed as part of that project. So really pleased to be starting that with colleagues early next year. And we've just had another proposal shortlisted. We put in an outline application, and that's been shortlisted for a full proposal for a study we're calling SNAPS, which is short break narratives acquired through pictures. And what we want to do is co-design an image-based resource that supports outcome-focused conversations with carers about their short break needs. So we want to co-design that with carers, and that we want to pilot it to see whether it's acceptable and usable in practice. So that's been shortlisted for a full application. So we're busy working on that at the moment, and really excited if that comes off. The other thing is, I'm sure you're aware, we've had a special edition of the journal Frontiers, and we now have some papers published from that in the public domain. So we have a paper that's published around using technology to provide individualised respite for carers in rural areas. Another paper looking at respite time use amongst dementia carers. Another looking at redefining respite following COVID. Another paper that's just been accepted this week looking at carers changing break needs over time. So that was a paper I co-wrote with one of my former PhD students. And then we have another paper that is in progress around using the value of respite model for practical program evaluation. I think that's one of your colleagues, Susan Summers, isn't it? So it's nice to see that taking shape and people being able to disseminate their work through that platform. So I think that's a really positive outcome. And then finally, I'm also involved with the Welsh Government Task and Finish group to actually refresh our national strategy for carers, and that work is ongoing. And it's a real privilege to be able to work so closely with our policymakers and practitioners to actually inform policy and practice going forward and ensure that our research findings and recommendations are taken up and reflected in policy. So those are my main updates.
That's great, Diane. Awesome. Good luck with that funding. I can't wait to hear how that image-based resource comes along. And quick question, I've been meaning to follow up on that special issue. It sounds like, because in full disclosure, there's been some concern since the spring about whether or not we can still publish some of the work out of Arch under Arch because of funding, and we did some DEI stuff and things like that. So still wanting to submit that common data elements paper for that and work on that editorial. And it sounds like there's still opportunities for that. Is there opportunities for others to still submit? Is that kind of a rolling thing, or kind of where is that at?
I don't know is the answer to that, but I can check with Frontiers about that and I can get back to you. So whether they actually closed the submission to new manuscripts, I don't know, but I can check that and I will get back to you.
That'd be great, because I know I submitted the abstract to include it, but I haven't submitted the full paper yet. But I'm hoping to do that still, if that's still available. So that's great. And then also wanted to suggest 2 resources for you as well, Diane, and you may already, but as you're looking to refresh that national strategy, encourage you to look at our national strategy, and I can send a link to that. Because again, it may not be relevant, but it's a nice framework, and maybe will give you some ideas that you haven't thought about. And then with that study around how to assess care needs, we do in the white paper, the recommended common data elements, have a tool we developed around assessing specifically for respite needs. And so that might be, again, something of interest just to look at, to see. So I can include links to that in the notes as well, and encourage you to, steal what's been done and supportive, and vice versa. If you have things that you've developed that you think might be helpful resources to share, I think we can continue. The biggest benefit of this Break Exchange network is that sharing and learning from others, and not having to recreate things that someone else already did. So always open to sharing and building off projects. So that's great. Wonderful. Okay, so those of you who are listening, and I'll include this in the notes, if you have updates or things you want to share, or questions or anything about any of the resources we've talked, feel free to send those to me. And at any time, I'm happy to push out updates, projects, and we're always happy to feature webinars and articles or project updates or funding updates in our newsletters that go out every month. So feel free to continue to push those up. So the main focus that we wanted to have today was sort of reviewing, the status of the Break Exchange and our strategic plan. So this past year, as we've already alluded to, has just been a little crazy. And so we kind of feel like it's a good time to reflect and kind of reset and think about how we want to renew the Break Exchange and engagement, because again, it is such a great network. We still have, hundreds of people connected on our listserv, and I feel like the engagement has gone down over time. We do the monthly networking meetings, and a handful of people show up, and like during the summer, like no one showed up. So we're trying to figure out how do we reinvigorate, and in that tone, like, perhaps there's a need to refine what we do to, as we reevaluate what is most helpful to the community. So I wanted to take a moment to just review and remind us kind of what we said we are and who we are, and what our plans have been to date in the strategic plan. And that was shared out with everyone, but I'm going to share my screen as well, just to use that as a reference while we talk. Can you all see that?
Yes.
Yeah. Okay, so this was our strategic plan that we worked on a couple years ago, and you can see it was intended to be a 2-year plan, and it really took us probably 6 months to finalize it and get it out there, and then the world happened, and we haven't done a ton of the new initiatives in the strategic plan. We've kept up a lot of the ongoing things, but it is time to either decide as a group if we want to extend or revise or refresh our plan coming up here. And so just as a reminder who we are, the Break Exchange is this international group of researchers, respite providers, agencies, and other individuals committed to building a culture of evidence-based respite. We had worked hard on a definition of respite that we wanted to reflect sort of that global vision of respite. We said respite is achieved through a short break from caregiving responsibilities that provides the caregiver a sense of relief, enhances family well-being, and strengthens the caring relationship. Respite can be achieved through a variety of planned or emergency services, break options, and supports based on the unique needs of the caregiver, individual they support, and other family members. Respite breaks can provide the caregiver time away from the individual needing care, or can be taken together. So the framing of that, you can see, is sort of that outcome based, that respite is the outcome. It's that there's services and lots of ways we can provide respite and relief to family caregivers, and also highlights the purpose being benefiting positive outcomes. Our mission was to provide members with opportunities to connect, collaborate, and learn from and with each other in order to advance respite policy practices and research around the world. And our vision is a world where high quality, evidence-based, meaningful respite is easily accessible to everyone. And our motto is everyone gets the break they need. So just wanted to reflect on that for just a minute to see if anyone is like, that doesn't fit right anymore, or gosh, I forgot about that and I love it. We should be promoting this more. Like, any reflections on sort of our revised mission, vision, and purpose for the work that we did a couple years ago on our strategic plan.
I think it still holds true today. Yeah.
I think it does, and it's actually clear, and it's really difficult to write something that aligns with an international audience as well, isn't it? We all use different terms and phrases, but I think that's really clear.
Great. And then we also developed values, and I'm not going to read through all of these descriptions, but refer people to this to think about. I again want to just do a quick, like, does this still feel right? But we said we value respite, shared learning, collaboration, person and family centeredness, diversity, equity, inclusion, and excellence and innovation. So again, the purpose of having values is those are sort of what ground us, sort of our moral framework of what we do, so that when we're engaged in our work, we are reminded that this is sort of the lens in which we see the world and want to do our work, and aspire to ensure these values are upheld in all that we do. So any thoughts, questions, concerns about our values?
Mm-mm. Mm-mm.
Right. And then in our strategic plan, we have sort of just the history and partnerships listed, our structure. And again, as a reminder, our structure is that we want to have a minimum of 9 members, ideally 3 from academic research, 3 from practice, and 3 family caregivers or care recipients who volunteer to serve renewable 2-year terms. We want to make sure every effort is made to ensure our steering committee represents a variety of countries and cultures and includes perspectives across the lifespan. And so this is something that I think we need to continue to focus on. I think our mix of academic and practice is good. I think many of us have dual roles as family caregivers, but we, can I think continue to find ways to elevate the voices of care recipients. We were a little US heavy. We've had a couple US people pull back. And so there are openings, and I would especially encourage our international colleagues to think about, one, their ability and interest in continuing to serve, because we do want to continue to try to increase the engagement and active work of steering committee, and also to think about recruiting others, especially caregivers or care recipients that can provide us with some more diverse perspectives. So one of the asks and calls that I'll put out in the notes is, for everyone to, again, think about their commitment, their willingness to serve for another 2 years. And if they have suggestions of individuals or organizations we could outreach to try to recruit additional steering committee members. Any thoughts right now on that? Diane, I see your hand is up.
Yeah, I just wondered, do you have any recruitment material that's already drafted that we could circulate to our networks? I'm thinking, for example, I'm involved in a European funded research and practice development network, and the focus is very much on older adults and older carers, but I'm sure that there are people who are part of that network who would be interested in joining. So if there was some template, that an invitation that you had, if you could share that with us, that would be great.
Yeah, absolutely. We definitely have that drafted. We'll have to look at it just to refresh it, make sure it's still relevant, because I think we use that for the initial recruitment. But we certainly can review, refresh that, and get that out to folks. That's great. And again, I don't think we're limited in the number. I think the more the merrier if we have engaged people. But ideally we want to just make sure we have some good diversity, especially within the international perspective and different, focuses on lifespan. Like we have a lot of people focused on aging and older adults, which is great, but making sure we have people that are reflective of children or different cultural groups that have more unique needs. So that's sort of an ask for everybody to think about how we can continue to grow the diversity and strengthen the backbone of this organization. And then we have members, which is sort of everybody else. So again, we have several hundred. I don't know, Tyler, if you were able to pull the most recent number for members or not. You might be stepped away for a second. I don't know if I put that in the meeting notes. We talked about it, but I don't think we put it in there.
Sorry, I think I believe it's 249.
249. Okay.
Yeah, from 15 countries.
15 countries, yeah. So we have a very large listserv of folks interested in what the Break Exchange is doing. And so I think one of the things we need to think about is how do we engage those folks more to get more involved in activities of the Break Exchange. And then we have a director, which currently is me, overseeing sort of the operational aspects of the Break Exchange. And then we have staff, which is Tyler as our volunteer staff now, and Katie as the voluntold student working to support this. So very grateful for their support. Another thing for the group to think about, that if you have resources, and it doesn't necessarily have to be financial resources, but people power. If you have a marketing person that we could borrow some time on, if you have a student or an intern that would like to get involved and help support things, and there's lots of little projects and things on our wish list that we wish we had time and resources to do. So another way to support is sort of that in-kind service from you, your organization, or affiliates of that as well.
And could that potentially involve international students contributing as well? So I'm just thinking,
Absolutely.
I have a PhD student who has a fellowship, and part of that fellowship is they have to spend time on placements in different organisations.
Yes.
So that might, I'm meeting him and the other supervisor tomorrow, so that might be something that we could think about. His PhD isn't short break specific, but he's looking at access of minority ethnic carers to services. So clear relevance to your work. So maybe that's something we can think about. Yeah,
absolutely. And we can certainly, we can review our wish list and also carve out if there's a project that meets, ideally, like I do a lot of work with students and interns in my world, and we want to make sure it's a mutually beneficial experience. So if there's something that could be leveraged to support the learning needs or interests of the student, we can certainly work on that as well, and leverage the break exchange as a great opportunity for students too. So that's great. And then again, we have sort of what the roles of the director should be. So this is what I am committed to: facilitating meetings, working to plan agendas, supporting the coordination of our activities with staff and the steering committee, signing letters of support for grant applications when relevant. We haven't got any of those recently, but a reminder that that is something we can do, is if it's helpful in a grant proposal to say you have support or involvement, even if it's like an unpaid advisory capacity, that the Break Exchange could write a letter of support and add that international network behind your project proposal. And then I help to oversee the documentation. So Tyler mainly is helping to keep the website updated and archive all our webinars and newsletters. And then continuing to champion respite-related research, including working with potential funders and policymakers. So we continue, especially through the work I do with ARCH, to try to network and talk and identify where there's opportunities. There's not a lot right now, but where there are opportunities for us to identify and push out opportunities that exist to help support the advancement of respite research, that's on the radar as well. So, so that is sort of our my role. And then the steering committee, we've asked you to participate in a 1-hour telephone conference. Actually, it's really not telephone anymore. We probably could update that: 1-hour virtual conference on a quarterly basis. So we haven't met quarterly recently. I think we want to try to continue to expand that as we get more engagement. Again, recognizing that people's time and ability are somewhat limited now. We ask that steering committees members continue to support the mission, promote the Break Exchange and the work that they do, suggest new research directions and collaborations, and assist in identifying opportunities to link respite-related research and practice. We ask that you help disseminate things and respond to requests for information in a timely manner, help to facilitate Break Exchange relevant communication with other partners and organizations you're with, maintain awareness of the activities by reading the newsletters and emails that we send, and also be available for expert advice and insights for decision-making and strategic planning, and then review proposals for research to be conducted in coordination with the Break Exchange. So any questions or concerns or things you'd want to add or change in the structure or descriptions of the role of the director or steering committee? The one thing I might suggest is, I don't know if quarterly is necessarily realistic. So I'm wondering if we want to say
Biannual?
biannual.
Biannual.
And then, if we have more activity and desire, we can always meet more. But I think if we can commit to twice a year, I think that would be probably more realistic. Right. So I'm just going to highlight this so that we can highlight that in the change. So what I'll do, since we have, not a full group here, I'll send this sort of revised draft back out to everyone too, to have time to think and reflect on and share thoughts back as well. Anything else that people think would be a needed change or suggested change?
I don't.
Okay. And then we have listed our inaugural steering committee members, which I think we can update this as we, confirm people's new appointments, so we can maybe keep the inaugural steering committees members and then add an updated list of current members of the steering committee. At the time of this being published, we had more than 225 members from over 12 countries. So again, I think that number is growing. Good diverse representation from our international colleagues in our broader membership, which is great. And then we had walked through the strategic planning process. If you remember, we did the mission, vision, valuing, we made the definition, we did a member survey, and then we did a SWOT analysis, identified priorities, and put together an action plan for things we wanted to focus on. And our initial strategic plan focused on 4 strategic issues around advancing research, policy, practice, and enhancing member engagement. Personally, I think these are still our strategic issues. I think it's really, how do we continue to move forward, especially, these are really, I think, core areas based on the mission of what we're trying to do, that we should always kind of focus on. So I don't think we necessarily need to add or adjust our big picture strategic issues, but welcome thoughts or feedback on that. Is there something else that you feel is really important that we should be focusing on now that we're 2 years later?
Not something different, but might we be able to capture the uptake of respite research evidence into policy and practice better?
Yeah, sort of the integration of all these.
Yeah, the integration of it. Yeah, so that a strategic issue or strategic aim is to. Sorry, just bear with me a second.
I'm just going to add that. I think that's a great suggestion, and I think within some of the activities we're doing, it's not explicit, but it's a focus. So I even almost envision this being more cyclical, right? Like the show something on this diagram to show the interconnectedness of this. And
maybe if it was done a bit like a Venn diagram, and we can show the interconnections, that might better represent what we're hoping to achieve. Yeah, that's a great suggestion. So we can work on updating that. Ken, any thoughts on your end?
No, I like that. I was thinking when Diane mentioned, like, visually, what could that look like? And I think you're just, I think like a Venn diagram or something like that, if I could show visually that, I think it makes sense.
Great. And then we had identified activities that support those core areas. And so I thought it'd be good just to give an update on where we're at with that, and think about if these are things we want to keep in there, if there's things we want to say, that's not relevant, that's too out of scope right now, or is there something new? So when we think about advancing respite research, things we had listed on there was identify and promote potential respite research funding sources. So we do have a spreadsheet of potential research funding that we try to keep updated. I think that's something we need to refresh, because it hasn't been refreshed probably in a while. And again, as people are aware of opportunities, we can push those out to the network, especially if it's an opportunity where there's a potential for collaboration. I think the Break Exchange is a great venue to say, hey, I saw this proposal and it'd be a cool project to do internationally, or you know, to like, I would need someone with this expertise and I don't have it. Is there someone in this network that's interested in working on this with me? So I think just reminding people that that's, you know, one of the intents of what we can do. Identifying collaborative research projects. So again, we can retain a list of that. We haven't had many people tell us like what they're working on, but I think eventually we want to be able to show that this network has brought people together. I do think, Diane, the special issue is one that we should be highlighting.
Yeah.
I'm going to just put that. I think is a really great example of how you know, we've connected on that. So if there's others or there's ideas people have, we can, you know, again, make a wish list of that. We said we wanted to submit at least one funding opportunity to support a collaborative research project. We did not do that.
I think that's probably overly optimistic given the current financial climate. And certainly here, although we have opportunities to apply for funding, a lot of those will not allow us to now cost in international collaborators.
Right.
Or if we do, they are, you know, very, very small percentages of their time, which is not very helpful. So I think we could say look for opportunities and be a bit more circumspect, because I think it would be good to still have it in there, but not maybe quite so committing to submitting a proposal, but look for opportunities to undertake collaborative international research around respite and short breaks, something like that.
Yeah. Great. I think that's great. So adjusting that one makes sense. This one, the special issue, that's actually down here.
Yeah.
So
Yeah.
that's great. So yeah, check that off the list. I don't know if we then want to remove this, or is this something we want to keep on the radar that maybe we can get another one in 2 years? I don't know, you know, what the thoughts are on that.
Potentially, I wonder whether when people contribute a webinar presentation, whether there's possibility to then get people to work up that presentation into a paper. Or it may be that they're already papers and they're doing it the other way around. But if not, there may be scope to contact people who contribute to the webinar series and support them to turn their presentations into published papers.
That's a great idea. That's a really great idea. And you know, if there's, again, I think it would help if we had some resources, but even like if there's opportunities for us to you know, even help support that, like as a co-author or a consult on a paper too, and be able to list the break exchange in those publications, have an acknowledgement, that would be cool.
And I just wonder whether you have any journals where you can put together a proposal for a special edition. Or I don't know how it works with your journals, but here sometimes we can put together proposals for special editions with maybe 4 or 5 short abstracts.
Yeah. I haven't done that personally, but I know it can be done. I know more often the editors put out a call because based on a topic of interest, but I think they're always open to suggestions. So for us, that would be just sending a letter of inquiry to the editor of the journal to say, hey, we have these, you know, and again, I like that idea of if we have some great webinars, we could say, hey, we have these projects that, you know, are interested in publishing. I think they would fit nicely as a showcase in a special issue. Would you be interested in working with us? So that's definitely something we could consider. So I think we could keep that on here and just kind of update it. Great idea. We're going to continue to highlight research monthly in our newsletters, which Katie, thank you for doing that. Feature them in our webinars and add any respite research to the website. This is one that I think we got to do a better job. We don't have, again, because of time and resources, we haven't added a lot of that to the website, but I think it's something we can and should be doing. So is there anything else you can think of, any suggested changes, additions to advancing respite research that we should incorporate or change or adjust? Again, I there's so many things I'd love to do, but I try to be mindful of like scope and resources and bandwidth, and so not wanting to overcommit and underdeliver. We can always do more, but anything else that's like ideas people have or things that would really help advance.
Yeah, I wonder if there's anything that we could say about better involving carers in shaping the research agenda. Certainly in the work we do here, we have national standards for public involvement in research that guide all aspects of the research process and the research cycle, from prioritising research ideas, formulating research questions, implementing a project, disseminating your findings, and involving potential beneficiaries in that process. So maybe that's something about how we can better involve and engage carers as research collaborators, and I don't mean research participants contributing data, right, but actual collaborators who are involved in informing the research process.
So I have on my wish list for a long time establishing a caregiver advisory board for research. There's some models we have here in the US, one in particular at UW-Madison, where they have a paid community advisory board that is trained, and they help to, again, a great model to replicate. They help to kind of give basic training on research process to the community members, and then those community members are available to consult with researchers on design of projects, recruitment materials, presentation of results. So it's like a sort of global advisory board. And if we could find a funder that would, and maybe that like John A. Hartford Foundation, or, that could be potentially something that we could try to seek some funding. So maybe the goal or activity is to explore potential funding opportunities to establish a caregiver advisory board to help increase involvement of caregivers as collaborators in research. How does that sound?
Kim, how is that, or how would that involve the National Family Caregiver Strategy? I mean, was that a part of that work at all?
So through NAC, they have and I've been pushing this idea with the project I'm on with them as well, but again, there's not like specific funding for it. They have an advisory board for the project that involves caregivers. But it's not specifically like a public facing one. So the one, and I can send you information about, it's called the CARDS program. It's basically like a consulting service that researchers can come to and pay to have people with lived experience review their research. So instead of, because it's so important to have that caregiver voice and input, but many people either don't have money in their budget to establish their own, or the time to build the relationships to develop a advisory board. So this is sort of like a standard advisory board that is willing to, review anyone's research to give feedback and input to. So it's a really nice model. And, depending on the funding, if we got funding to pilot that, maybe it's offered as a free service to researchers in the beginning. And then depending on the success and feedback from that, then it could become, something that it's a fee for service, and we ask people to build that into their research proposals. That's how the model works at the CARDS program at UW, is we build in money to say we're going to engage with the community advisory board throughout our project. And I can send information. I'll highlight this so I remember to send information about that. So that would be cool. And then on that other, so that kind of covers like one more infrastructure base, but I think making a focus on, I think, adding resources around that and promoting resources on how to do that. So maybe like down here, focus on engaging caregivers as research collaborators. So that could be maybe a special focus we have, is identifying resources and promoting, you know, ways and things that can help with, you know, how do you meaningfully engage caregivers as collaborators. And there are some great resources that I have and I'm aware of that we could certainly add to the website. Unfortunately, one of them is one that we can't share right now, so because of political stuff. So there is a great guide on how to engage in culturally and responsive respite research that has been developed, but we're not allowed to share it quite right now, unfortunately. But hopefully that changes. Yeah, Diane.
Yeah, so we have a resource that we should be able to share very, very soon. So we've been developing a MOOC training program based on our experience of involving older adults and their unpaid carers in research. It's not short break specific, although I cover some of the short breaks work. And once that's available in the public domain, I'm happy to share that resource with you.
That'd be great. And I can share some of the existing resources that I know of that aren't specific to respite, but the one that was developed through the Arch project, it's ideal to push that out, but we just haven't gotten the okay from the government to share that yet because it's basically DEI. So, yeah, anyway, yeah, great ideas. Okay. So let's see where we're at here. Okay, I was like, did we say we're an hour and a half? We said an hour and a half. Okay, good. You guys are troopers hanging in there. Again, for people who are listening or not able to attend, this is still all draft. We'll send this out to everybody to give additional feedback and thoughts on it, and then hopefully come back together or, work via online to finalize sort of an update and refresh our strategic plan moving forward. Then we have advancing policy. So this one we have had on our radar, but haven't quite done. Again, I think limited by resources. We've had some preliminary conversations with the International Short Break Association and some interest in there, but that has been a little bit in reorging disarray a little bit. So I think it's still something we could focus on in the next 2 years and would be really interesting. I think it's going to need a commitment from, we'll need some resources to make that happen. But the idea is, could we conduct and see sort of what are the best practice policies in other countries, or kind of a compare and contrast the different policies and share that out for information and to help people look at different models. I think of the respite as a right policy, like to let people know that exists and what's good and bad about it and where to get more information if that's a policy you're interested in proposing in your country, right? So I think having a sort of a list of what are the current policies that are supportive of respite would be really helpful. Again, it's finding the resources to do that work. So any thoughts on that?
I just wonder whether that's something that could be incorporated into a PhD project. And if you've got PhD students doing work around respite, whether it could be a possible, PhD project or postdoc project.
Yeah, that would be perfect. Yeah. Yeah, that would be really, really great. This one, I think, naturally follows this. Once we kind of know what's happening and what is working, what's not, I think we get a small committee together to put together a position statement on what we feel is the best policies to support respite for caregivers. And but I think we kind of need this first. So, I think it's important to keep it on here. It might be a little challenging given the political climate right now, at least in the US. But I think, hopefully in 2 years that will, at the end of this strategic planning process, this might be a little like year 2 thing to focus on. And then we can certainly continue to add resources as we find them. And if you find policy resources that we can share, always send any resources that you think would be beneficial to us, and we can get those up on our website. Any other thoughts or things you think we could do to help advance respite policy? Okay. So then advancing respite practice. Again, this was a bigger project that we were hoping to have done, but again, resources have limited that. But if we had a small committee that was interested in working on this, we'd love to, have like a showcase of respite models, so that people can see those different types of respite programs that exist around the world and identify who's willing to sort of be a host for the peer visit program. That's something that is happening organically with the International Short Break Association, where, I'll give the example of like Poland, who was a few years back had no respite policy or national programs, and received funding with new policy and legislation that passed to establish respite supports. And they reached out through ISBA and went and visited Germany and Scotland and different places to better understand how their programs worked, how they were funded, instructors. So it's sort of like a mentorship program, or a going on like a field trip to see how other people are doing things, to get ideas for programs. So I think there's a lot of interest in people wanting to say, hey, yeah, come learn more about what we do. It happens very organically, but we wanted to kind of create some infrastructure to support and encourage people to do that, not necessarily fund it. We don't have the funding to like pay people to go to other countries to check it out, but at least to present the information so people know, like, hey, in Australia, CARES New South Wales is willing to host you and show more about their national systems of supports anytime, right? So again, I think it's a great idea. I think, like everything, we got to figure out, if it's feasible, who's willing to be involved and lead, or how do we secure funding to bring someone in or have a student support some of them. Any thoughts on that activity? Okay. And then the things that we continue to do that I think are still feasible on our end is hosting the Student Respite Collaborative meetings. Those are going great. We try to feature a respite program in our monthly e-newsletter. Katie's great at that. But again, if you are aware of or run any programs that you want to be featured, send them our way. We feature respite programs in webinars, and we, want to continue to add resources around program evaluation to our website. So again, a reminder to share resources that you think are relevant, and we can get those up on the Break Exchange website as well. Anything else that you think would be, suggested changes, additions to activities to help us better advance respite practice?
The only thing I could think about, just with what's happening here in the States with with funding for caregiver sport and caregiver respite, but knowing that there are some funding that is started, is ongoing. I think of like the guide model, Kim, right?
Mm.
That's an 8-year grant, and I just spoke with someone the other day who leads that work in the Western New York area, and they were informed that work is continuing, and I think it's like they're in year 2 of year 8, and I know that respite is a key component of support for caregivers, that go through that model. So I guess I'm just thinking about if there's opportunities to talk about the changing landscape and opportunities that are still there or that have emerged, like I guess I'm just wondering, right? 'Cause, I mean, there are some programs that have started, and and I know that, like, again, for the guide model, that, I mean, that is one model that is presumably going to continue to grow, because I haven't heard that will be cut, right? So
Yeah. I think if we added this activity,
Yeah.
identify and share examples of new and innovative respite models and have those on our website, I think would be really helpful.
Yeah.
I will just say the guide model, great in theory. I don't know if you're aware that the fundamental flaw of guide is that the respite provided in the guide model for reimbursement has to come through an agency. You can't do self-directed respite. So, and the reality is most people receive and prefer to choose their own respite providers. And so we just heard an update at, I forget what meeting I was at, and it was NASHB had a respite summit, and we heard an update from someone who's involved with Guide at the federal level, and they said they've had underutilization of respite in that model, and we're like, well, it's because one, there's not a lot of respite.
Yeah.
Like, you can cover respite, but there still has to be respite programs to cover. And the fact that the limitation is it has to be a respite agency, it can't be self-directed respite that's covered, makes it even harder for people to get access to that respite. So though respite is included in the bundle of reimbursable services through Guide, it's not being utilized.
Yeah,
I
I have heard that in conversations that I've had. That it's not, and I heard just the build up. The build out has been slow, very slow. And probably because of that, because there's the capacity issues. But but I guess that's just one example. There may be more, of what is new, but
definitely. But again, I think something that this group, I think, uniquely can do too with, sharing these examples is like sharing it with that critical lens of, this is great, and here's how, if you could do it in your country, I'd recommend you do it differently. Right? So I think just the conversations around that through this network is really important and helpful. But yeah, and I think I shouldn't say I think, I'm hopeful that they are listening to the feedback they've been getting about that, and open to considering changing that policy. So I think a lot of people have shared that feedback with them, and they're seeing it in the numbers that it's, while it's the most requested support service, it's being severely underutilized because of the limitations of the policy. So yeah, but great addition. Anything else on practice that you'd want to add? Okay. So then the last one is member engagement. And this is one where I think we really need to focus on almost as a priority, because I think this network is as good as the people engaged in it. I think we can do more activities and have, subcommittees and have more resources the more active people are and more aware people are that the Break Exchange is here for them. And something we've struggled with. So I think this, to me, is a big priority. Diane, did you have a question or comment?
I did, yeah, but it relates to practice rather than to
we can go back.
table. So I just wonder, is there any opportunity to put something in around highlighting respite to students on professional programs, so trainee medics, trainee health professionals, trainee social work students, maybe and that could be simply signposting them to your resources, or it could be something that's pre-recorded rather than that's something that's labor intensive, but maybe thinking around how you could target people who are on professional programs so that they are carer aware and respite aware at the point of receiving their training.
Yeah, certainly that could be something, we have a lot of, activity around our respite training and the student respite program trying to do that already. So I think globally sharing those resources out to promote respite training and employment, I would say volunteer and employed opportunities to students could certainly be on, and maybe that's again, I think we need a group to look at developing materials to share, etc., so that if a group was interested in leading the development of that, we could certainly then push that out and have resources on the website, to say, here, and we have some of that through the student respite program, like we have flyers for that program and things like that. And that's a great venue for people to come talk about how do we better engage students in respite. But we certainly could share out more of those resources and consider developing our own resources. Great idea. Okay, so back to the last one, which is engagement. Again, I think we can review and send out our spreadsheet of stakeholders easily. We have a promotional flyer. We can refresh and get that updated and out. We did do the member survey, but we had like 4 people respond. So it wasn't very meaningful information. So I think we might want to consider, I don't think when we looked at the results, there wasn't really anything very meaningful in the results that we got. But I think we should consider doing that again and thinking about how do we get more people to respond. We do continue to, as the ISBA conferences happen, we have been working to have the networking event, which is great. We don't know yet when the next conference is going to be. They're still working through that. We still have the opportunity for people to complete member profiles. Again, not as many people have been doing that, but we're trying to promote that. We have the networking hours. Again, we've had really bad attendance at that. We've tried to identify steering committee members to sort of host those networking events to maybe be more of a draw for people to come, like talk to people and engage around a conversation in those networking hours. So I know Tyler continues to put that ask out there, but just as a call to the steering committee to think about, like, if everyone could host one of those a year, it'd be a nice venue to showcase the work you're doing, not in a very casual way, and just talk with others. We continue to do the monthly newsletter and the webinars at least quarterly. But the big question is, we're doing all this, yet we've built it, but people aren't coming. So how can we better engage members? So again, I know this is a hard time in the world, and people continue to just be busy and overworked, and finding time to be involved in one more thing is so hard. But I feel like there's so much potential value in increasing engagement in the break exchange. So how do we sell that value? How do we really work to increase not just the number who are on our listserv, but the number of people who are actively engaged in using the network as it's been intended to identify partners, to work together collaboratively on projects, things like that. So open to ideas and suggestions around member engagement.
Do you get any feedback from people who have engaged? Do you ask for them to feedback?
Yeah, we have.
I'm just thinking about what are the potential barriers, and I mean the time differences are obviously one
Yeah.
barrier, aren't they? But whether you've had feedback and you get a sense of what are some of the barriers to engagement.
Yeah, we have, again, the purpose of the survey is to do just that, to identify like how people are engaged, how we could better engage them, better support them, but we didn't get very much response from that, right? So I think that's the concern. But certainly maybe that's an activity as we strategize around how do we identify those barriers and opportunities and kind of come up with a plan, like an engagement plan. That might be a project to think about, like how, just all group together to think about like how can we, whether it's rebranding or innovative ways to market this network, and find out what is most meaningful for people, because we put a lot of work into developing the infrastructure and the website and the webinars and the newsletters, and we want to make sure that's valuable, and if it's not valuable, then we can redirect our efforts to something else that is, but we're having trouble even getting people to tell us what's valuable and what isn't. So it might be really focusing on that assessment of it, maybe as a starting point. I don't know, other thoughts? Like we got tons of people, right? Like we have hundreds of people who are interested in this. We just have to figure out how to like actually connect them to things better. So, and whether that's changing the things we offer to meet their needs or finding better ways just to communicate and encourage that engagement. So a seed to be planted, maybe. Did you have something you wanted to add, Ken?
No.
Okay, great. And again, like right now we have this great graphic that shows, sort of ways to be engaged, and, maybe it's a lot, or maybe it's overwhelming. I don't know. But that's something I think we can focus on. But I think this is a great start to maybe to refining this strategic plan. I'm going to stop sharing my screen right now. I will, like I said, send this out with the notes we've made with the meeting minutes and encourage all members of the steering committee to take a look at it, provide any additional thoughts and feedback they have, and then we'll work on updating this for the next 2 years. So the only other thing we wanted to just share kind of general updates around the break exchange. Again, wanted to acknowledge the ongoing support that Arch has been providing for the break exchange. Unfortunately, as I alluded to earlier, currently Arch does not have any funding. Their funding is ceased, and so we don't have any funding at all right now for the break exchange. I know if Arch is able to get funding in the future, they are hoping to continue to support, but we are constantly looking for opportunities to fund the break exchange. So if you become aware of funding opportunities that may align with, general infrastructure for the break exchange and or specific projects that we are hoping to achieve, please let me know. I'm pretty good at writing grant proposals if I know that they exist. So happy to work on that. And then, just a reminder for updates that we have our networking hours, our webinars, information about the innovative and exemplary practices. We have the Student Respite Collaborative. We have the work of the CAR that is, definitely something we're trying to push out. But I will, continue to watch for the newsletters, watch for opportunities to host networking hours and webinars, and please just help spread the word. I think word of mouth is always the best advertisement, still today, right? Like we can send a million emails and people, either get them lost in spam or ignore them because they get way too many emails in a day. So think about, like, when you're in your networks, who are people or spaces where it would be worth sharing information about the Break Exchange. And we can send you flyers. We can send you a digital one that you can print to share if you're at conferences or at meetings with partners that you think might be interested in being more involved and connected to the Break Exchange. So definitely reach out, and we can share the flyer and the meeting notes too, to encourage folks. But yeah, that is all on the agenda. I know we're coming close to time. Is there any other questions or discussion or comments or feedback that people who are attending today have? Great. Well, again, I appreciate your time. I appreciate your continued support of the Break Exchange. Again, I think there's so much untapped potential in this network that we have the ability to continue to leverage and grow. And I'm what we've gotten to so far with our very, very limited resources, and dream and imagine all the great things we could do with more resources. But your support and continuing to be involved is really meaningful. So I appreciate your time. I thank you for all that you do in your own spheres of influence around supporting respite and advancing evidence-based respite in your areas around the world. And please stay connected. Reminder again to share out updates, information, or questions that you have for the group. And then we'll be in touch. I'll send out the meeting notes, this recording, and the strategic plan, the flyer, and links to all the things we've discussed today. I'll probably get that out tomorrow, hopefully, to folks. So thank you again for being here, and enjoy your day or your night, depending on where you are. And we'll be in touch soon.
Okay, thank
Thank
you.
you so
Take care. Bye.
much. Bye.
Bye. Bye.